At the beginning of the pandemic, people were told that they needed to be isolated at home for 2 weeks if the result of COVID-19 shows positive. There was a misunderstanding about the recovery. It seems like people can heal by being isolated at home for 2 weeks if you are affected.
Miscommunication. It's a huge hole in public health messaging. That's what the government tells you. That's what people believe. They think it's those 3 symptoms and you'll be fine in 2 weeks, and that it only affects older people and that kids don't get it. There are so many false narratives.
The Office of National Statistics reported that almost 1 million people in the UK were living with ongoing symptoms after COVID-19 in the 4-week period ending 6 June. 33,000 of them under 16 years old, and almost 500,000 of those living with long COVID were 17 to 50 years of age. In April, the statistics revealed that 122,000 people with long COVID were healthcare workers. The symptoms vary from person to person.
So the fatigue was still there, the breathlessness, the headaches, the feeling just completely wiped out, the muscle aches, like my whole body was sore, and it just wasn't getting any better.
And then I was off work for 4.5 months. I literally, at one point I couldn't walk 100 metres without getting out of breath. I was very, very tired. I'd get out of bed, come downstairs, sit on the sofa and fall asleep again.
I still have heart pain, a shortness of breath, fatigue, joint pain, muscle pain, mobility issues, tinnitus, headaches. I still have all those things, difficulty concentrating.
At this moment in time, the biggest trouble for those long COVID patients is how to define recovery.
And I think it's just left you feeling a bit broken, like you were ill, and then you just never kind of got better, but then everybody gets back with their lives. But I don't feel like I've got back to my life.
No, not yet.
I remember driving to a health appointment and driving down a road I used to cycle down every day to work, and that made me cry because I just had a flashback to what my old life was like.
Medical experts haven't worked out what long COVID mechanisms are.
From previous similar viruses to this COVID infection. So if we look at reports from SARS, for example, or MERS, it was reported that recovery can take up to about a year, and that's what we can expect from this illness as well. But what I have been seeing is, or what we have been seeing reported, is that people are still debilitated even a year on. So I guess the answer to that question really is that it could take up to a year, it could be longer, but at this moment in time we just don't know.
Those patients are suffering pressure to return to work and get back to normal. Daisy Hopkins, who is the midwife, she contracted COVID-19 from work. She hasn't been getting better since last October.
Worried about the brain fog and trying to remember things, and there's this stress and anxiety of trying to just cope with it all, because you feel like it's been going on for so long that you can't keep asking for help. And so then you feel either guilty to ask for help, or you feel like a bit pathetic, like people think you should just get on with it. So even though like we're dressed and I've put makeup on or I'm at work, it's almost like people think, oh, you're better, but you're not. And I think that's really hard.
Adam Hopkins, who is Daisy's husband, he infected COVID-19 from Daisy. The ongoing symptoms caused him to be depressed all the time.
It's quite embarrassing to tell people that you're not physically capable of doing it. So I'm a big guy. I've always been quite strong and active, and then to say I haven't got the strength to move something at work, it is a little bit embarrassing. I've had that a few times recently.
Both of them must manage to look after each other and their 10-year-old son after they were all diagnosed to long COVID at the same time.
Well, obviously if he got stuck, he did come to us. We could help to a point, but nobody was allowed in the house, so we had to self-contain between the 3 of us.
But I felt awful that I wasn't able to look after him. in that time, really. We were just stuck together on our own.
Why they were ill for so long? How to treat it? How long does it take to recover? Is it just a 2-week thing? Sort of these questions be asked by long COVID patients every day.
Like, I'd like to know why my hands and arms still hurt all the time and what I can do to make it better. Yeah. But all I keep being told is, oh, hopefully in time things will be better. But nobody's actually seen me. It's all on the phone, so nobody's looked at it or looked into it to investigate further to see what's wrong.
You know, amount of people that have had long COVID being referred into our clinics is so vast. It does take a bit of time to be able to get through it all, and we are trying to facilitate that as much as possible, having extra clinics, for example. So we are tackling it, but I completely understand people's frustration. It is a long wait.
Long COVID has become a broad term for the public and medical experts to define the effects of COVID-19 that continue for weeks or months beyond the initial illness. Dr. Yushman Gupta, who involved in the long COVID research in University of Nottingham. In terms of ongoing research, long COVID researchers are saying, how can exercise rehabilitation methods be worked for those patients?
Initially, we thought, to be able to try and improve the fatigue, we should try and improve their exercise tolerance, really get them up and going, and really exercise as hard as they can to be able to build up that muscle, build up that strength again. And we've soon found out that this is the wrong way to go about it, because a lot of these people, if they try and push too hard, they become fatigued for days and weeks on. So we've quickly realized that methodology is not correct. So this idea of graded exercise, so try and do a little bit of increased activity at a time, and just slowly build up that strength, build up that exercise tolerance, rather than thinking that they'll be absolutely back to what they were before having COVID in a couple of weeks' time. That's not the correct way.
Although long COVID is gradually being recognized as a serious problem, NHS has spent 89 clinics in England and opening 15 pediatric pubs. But if you live in Scotland, Wales, or North Ireland, you even don't have those clinics.
What is this used for?
Energy expenditure. So the idea is that when people breathe in and out carbon dioxide and oxygen, from that it can calculate what the body's energy that it's actually using at the moment. So we use it in different types of studies, but normally after giving a glucose drink, we expect the energy expenditure to change, so we can report all of that through here.
At this moment, those long COVID clinics are still no treatment and no simple test for it. Claire Hasty, who is the founder of Long COVID Group on Facebook, she set up the group in last May. She has been living with long COVID for 17 months since last March.
I wanted to share information and give people a space to learn from each other. So the group has grown and is now more than 42,000 members in more than 100 countries and territories around the world.
With the group developing, there are lots of people asking for join it, but they have very strict criteria. People have to have been ill for 4 weeks or more, or be caring directly for someone who has those symptoms.
Because people are sharing very vulnerable information that they wouldn't want their family members to know about or their employers to know about. So people can be very open and show quite how hard it is for people, because no matter how sympathetic their friends and family or bosses are, nobody can understand what it's like really unless you're living it. The symptoms are so bizarre.
In the early days, no one knew long COVID. Most of people focus on the acute cases in hospital. However, the ongoing symptoms can be damage anyone. 3 of Claire's sons have also been ill for a long time.
We have a sister group, Long COVID Kids. My children have it also. Babies, toddlers can get it. elderly people can get it. My group has some very, very fit and active people, previously fit and active. We have marathon runners, we have a Commonwealth Games athlete, we have people who are highly active, actually a high proportion of people who were highly active in our group. So you would never ever think that people were in any way weak, resilient, or not resilient. So I don't know if it's a genetic thing or an immunological thing, but there's absolutely no way of knowing whether it could be anybody that is affected.
But what we're finding here is that even people that have had mild symptoms end up getting long COVID. And that's quite a large proportion of patients. And what's even worse is that in a lot of these patients, all the tests that we do will be normal lungs, normal blood tests, normal breathing tests, and therefore it became quite difficult to know what exactly was causing all of these debilitating symptoms. And I guess, and to a certain extent to the GPs, it would be difficult to pinpoint why exactly patients were getting these debilitating symptoms before actually having information about what long COVID was.
Well, there's more than 200 symptoms have been documented by Patient-Led Research Collaborative, who are professional researchers as well as living with long COVID. So they issued a paper just after Christmas, which 7 months later has only just been published this week.
People have gone from first and second wave pandemic. Fewer people are dying, but it doesn't mean there's nothing to worry about the new disease. The long effect of symptoms are still bringing people's day-to-day life. To react to study from Imperial that the Department of Health commissioned, that 30% to 40% people who will catch COVID will still have symptoms at 12 weeks or more. The most important thing for long COVID is to avoid getting COVID.